All right, Jim, thank you. Libraries across the state are working to bridge Texas's mental health services gap. So a recent article in the Texas Tribune found the libraries are now using their facilities to address the demand for counseling, substance abuse services, and housing. Stephen Simpson from the Texas Tribune joining us now for Insight. Stephen, thank you so much for being here.
Thank you for having me.
Okay, so let's start with the town of Smithville. So libraries there, they saw a need for more mental health resources. They created these book clubs for marginalized groups like veterans, as well as people of color, as well as people in the LGBTQ plus community. How did those really address the need for mental health resources, and how was it successful?
Well, the book clubs were created during a time during the pandemic when no one could really meet together. And so that was one of the main objectives, was to kind of continue to build up the community. The book clubs were such a hit that a lot of the participants, once the funding for this program ended up joining the library's general monthly book club. And the LGBTQ plus book club still meets monthly. But I've heard the most important thing is giving a safe space to people to kind of just be themselves.
Okay, the St. David Foundation also has created a 3-year pilot program. This is for 8 Central Texas libraries. How is it ensuring that the mental health programming really flows into the community-based programming there at the libraries?
So the Libraries for Health initiative is pretty much puts a peer support specialist within these libraries. Their job is to, one, address people that might be going through a mental health crisis when they come to the library, but also to train librarians on how to see what the signs of mental illness are and sort of how to react to that kind of thing. And they also train pretty much anyone else who comes in to be another peer support specialist. So they're kind of building on the community already that they have.
Okay, and we know that there's really a workforce shortage. You highlight this in your piece with some data in terms of mental health care workers. How do these libraries really hope to create and just sustain mental health programming within their facilities?
So one of the things that came out of the pandemic was pretty much a large amount of resources being available to rural libraries. That in forms of grants or just donations from nonprofits or things like that have allowed a lot of these libraries to start building up mental health programs, whether that's just like having calm corners or mental health kits, or sort of like the Libraries for Health initiative, it might be bigger. I would say the one thing everyone's concerned about is the sustainability, because once these funds start to dry up again, they're probably going to need some state help.
Okay, Stephen Simpson from the Texas Tribune. As always, it's good to see you, and thanks for joining us.
Thank you for having me.
The head